My name is Dr. Victoria Katasi. I am a specialist treating children with brain and spine cancers and blood disorders. I'm also a health and wellness expert. So welcome to today's edition. It's a continuation of our lifestyle series where we talk about lifestyle diseases, and today we are going to talk about eating disorders. So when we talk about eating disorders, and some of the examples that I'm going to talk about are some of the commonest, but they may not be the only ones there. So there's a disorder called anorexia nervosa. This one really refers to someone being underweight because they have this excessive restriction of how much they eat or of their diet because they are actually scared of putting on weight. And then there's a condition we call bulimia, where in this case, somebody has that fear of putting on weight, so they eat, but every time after eating, they go and purge, okay, or vomit, force themselves to actually vomit out what they've eaten. And then we have the binge eating, where somebody just eats a lot in such a short time. And this usually happens to people when you're in times of stress, and you end up eating like a whole box of Pringles, I don't know how many packs of biscuits, pack yourself with chips and all those kinds of things, yes. One, we've actually talked about stress can be a cause of an eating disorder, especially now when you look at things like a condition like binge eating, because some people's trauma response or stress response is eating, is food, okay? And so every time someone feels like they are upset or something is not going well, they resort to eating. And unfortunately for most people, they choose to eat what is unhealthy: ice creams, chips, I don't know, whatever, all kinds of things that you can think about, sweets. But also the other causes of other eating disorders like the bulimia and the anorexia could be because, one, of environmental factors, and we are looking at things like peer pressure, okay? The kind of people that you're hanging out with. So you'll notice that these may be more common in either girls, especially around the teenage age or young adulthood, but also maybe people in certain fields like models, okay? Because one, you're trying to fit into the environment or the society of the people that you're hanging out with. You want to look good and have a nice body, your nice figure, fit into the current clothes. You are attracted to what you see on the internet of all these kinds of influencers who are out there and models and the way they look, and you want to have what you may call a perfect body. So you're actually driven to having excessive dieting and diet restrictions, okay? Or resorting to things like purging every time you eat because you're scared of keeping the food in there and having the weight on. Then it could also be because it's a mental health, because you have some mental health, a mental health illness or a challenge, and this can push you into either eating very little, you're constantly aware, or you're excessively worried about what you look like, and you're anxious, okay, about how you look, or it may also be familial, okay, for some people, yeah. Okay, so some of the health-related risks or the consequences that you can get from having a lifestyle eating disorder include, especially now we start with people who have anorexia, and that's where we say those who have underweight because they are eating excessively little, so they live on a restrictive diet, okay? So one is that you're going to affect the ability of even just your body to grow the way it should grow. Now let's talk about a teenager who is in that growth spurt, okay, of puberty. And at this point, you actually need more nourishing food for you to grow to the extent that you should grow. But if you're actually restricting yourself, then you cannot reach that period of growth or the spurt that should actually get to. But also you may suffer from what we call malnutrition, okay? And this malnutrition being undernutrition, to the fact that someone comes and they are so small, or what we call cachexic. And at that point, what happens is that when you actually become that wasted, okay, your body functions operate at the minimum, and sometimes they actually shut down, and you're not actually able to even carry out your normal function or duties. You cannot actually carry out, even going to work as a normal person may become difficult, or attending school. But also because you need food to function, for your brain to actually be active and create, simulate, study, be innovative at work. When you live in such a state where you're constantly restricting yourself and you're not taking in what you need, you actually also affect your ability to be productive, your ability to actually create and produce work that you should be able to produce or study as well as you should study. And there are other things that will also affect, like, you know, because you're eating very little, you're not able to build your bone density like you should. So with time, you start to have cases where your bone mineralization is actually affected, okay? And there's a breakdown of your bones, which can predispose you later to things like fractures. So really, you generally affect your entire system of the body. And then for things like where people eat, where they have bulimia, they eat and then they go and purge. That constant purging, first of all, causes corrosion along your system, your digestive system, because remember, in the stomach we have acid, okay? And so every time you're forcing yourself to puke and puke and puke, you're actually also causing what we call reflux. The food is coming back, and so that acid corrodes your system. You may end up with a gastritis, that is like, you know, kind of like some wounds in your stomach and along your digestive system. But also with time, you start to get into other things we call like electrolyte imbalances. Like there are some minerals and salts you need for you to thrive as a human being, and these you get from food. But every time you're doing this and throwing the food out, you affect these. And if you get into a state where you acutely lack certain electrolytes and minerals, you can actually, you know, faint or become unconscious, start convulsing. So it can actually get into really an acute illness and an emergency situation where someone actually needs to be admitted and get into an ICU or an emergency setting. Remember, like we have said, some of these eating disorders may actually be to a point where they are severe. So you may not be able to manage it by yourself at home. So first of all, it's important to seek medical support, at least walk into a hospital or look for a therapist and be able to air out this challenge that you're having. And then you can actually be started on a journey of recovery, both mentally, but also nutrition-wise, okay? Because you need to have a change in your mindset for you to actually accept that, okay, you know, it's normal to have, you know, my body to have a bit of muscle, okay, and a bit of fat, not excessive, but what is normal for me, like what we talked about, a normal BMI previously, for me to actually survive and function, and that I look beautiful when I am the way I am, as long as I am healthy and fit. Anyone out there who is suffering from an eating disorder or who thinks that they may have one of these conditions that we've talked about, my message to you is that this is still a condition that you can overcome. Like we've said, you'll need support along the way. You need a mindset shift or change, but also help for someone to walk with you in this journey, and also the advice on what a proper nutrition or proper diet should be like, and someone to help you along the way monitoring this diet. So yes, as a doctor, these are conditions that I could actually deal with, but also I can be able to, depending on how severe the condition is, I can be able to connect you to maybe a facility where you could get better nutrition support, like if you need an admission or an inpatient or emergency care. So please reach out to me, and my contacts will be in the link below. Thank you.